Hormonal versus non-hormonal birth control. This is what we're talking about in today's sex ed Q&A. Let's look at the differences and let's look at some important things to consider when you're deciding what option to use. I'm Janelle and I am a health teacher and a sex educator, and I'm here to help you make empowered decisions about your body and your sexual health so that you can live with more connection and pleasure. Before looking at how to prevent pregnancy, we need to make sure we know how pregnancy happens. So there are 3 things we need for pregnancy to happen. We need an egg, we need sperm, and we need a uterus for the fertilized egg to embed and grow and turn into a fetus and a baby. This also means that if we want to prevent pregnancy, we need to stop one of these things from happening. We need to either stop an egg from maturing, we need to keep sperm out of the space, or make it very difficult for a fertilized egg to embed in the uterus. So this is where we see the difference between hormonal and non-hormonal birth control. So hormonal birth control works by stopping an egg from maturing. It disrupts the ovulation and our menstrual cycle, and it disrupts the process of maturing an egg and releasing it. So if the egg doesn't mature and doesn't release, there's no egg available for it to be fertilized by a sperm. So for these hormonal birth control options, basically it releases a synthetic hormone in your body that disrupts the cycle and prevents ovulation from happening. So things like a pill, a ring, implant, patch, shot, hormonal IUDs, all these things release synthetic hormones in your body. So while these things can be very effective, especially the things that don't require daily use, like an implant or an IUD, there can be some very severe adverse side effects, and it's really important to consider that because you are putting a synthetic hormone in your body. So pause the video and look at these side effects, and this can give you some context of things to talk about with your medical provider. For non-hormonal options, basically we're just trying to prevent the sperm from being in this space so that it can't fertilize an egg. So one of the simplest is withdraw, to pull out, and to just not ejaculate in the vagina, but there is a higher user error with that, so it's not necessarily the most effective. We also have an internal condom, so this goes in the vagina and prevents sperm from reaching the egg, or we have an external condom that goes over the penis. Do not use these 2 together, use one or the other. Another non-hormonal option is the copper IUD, and this copper here, it doesn't release hormones. Instead, this copper makes it very difficult for the sperm to move around and makes it very hard for it to reach the egg to fertilize it. Even though the copper IUD is very effective, there are some side effects, so be sure to pause and look at those side effects. All right, I hope that answers your question. Let me know if you have any more.